Hi everyone, this is Courtney from Prevent Blindness Wisconsin, and I want to welcome you to day 3 of our 5 Days of Adult Vision Health series. This series is all about diving deep into that adult vision health risk assessment that we use and understanding the significance behind each question and why it is asked. We also want to educate adults not only on the importance of those questions, but why it's so important to go in for regular dilated eye exams as well. So day 1 of the series, we dove into glaucoma and how glaucoma can really be linked to families and genetics. Day 2, we focused on injury to the head, but also injury to the eye and how that can affect vision over time. And also too, if people are noticing a change in vision, they really need to consult their eye doctor and make sure everything is looking okay and everything is healthy. So for day 3, we're going to dive into question number 5 and number 6, and this all has to do with pain and discomfort in or around the eye, but also too, here we're going to dive into different demographics and why some demographics are more at risk for vision conditions. So number 5, you can see it says, do you have persistent pain in or around your eye? So with this is in red. So I really want this to kind of show a significance to you. With this, we're going to touch on why this question is so important and why it is labeled red as we get into the nitty-gritty of this. But I really want this, again, to raise that red flag in your mind when you see this question. Number 6 is, are you African American, Hispanic, or Latino, and age 40 years and older? So as we talk about different demographics and the aging of the eye, we will really see who is more at risk for certain vision concerns. So number 5, talking about pain and discomfort in the eye. When we see this question, if someone answers yes to it, whether you are helping a client fill this out or you're reviewing it for a client, or you yourself are doing this risk assessment just to see where you stand with your vision health, it's very important for you to really consider this question. So if someone answers yes to this question, we really want to do a little bit more investigative work. With this, we typically ask if it is a sharp, consistent, and persistent pain in or around the eye. With this can lead to more serious vision concerns if this does exist with that client. With this, it can show signs of that closed angle glaucoma, or if someone has had an injury to the head or the eye, if there is damage in the eye, that can also cause this pain as well. So we really want to make sure with these conditions, if it is that sharp, persistent pain, we refer that individual to immediate vision care. We really want to make sure everything is healthy and safe for them, and if actions need to be taken and treatment needs to be started, we want to start that as soon as possible. So here, if it is that sharp, persistent pain and it's really raising a red flag for you or the client you're working with, we want to refer them to immediate vision care. However, with the eyes, sometimes we can get dry eye, they can get irritated, they can run because of allergies, they might be very tired too with the digital world we're in today. So again, if it's not that sharp, persistent pain, we really want to look at, okay, what's causing the irritation for them? So there are some common concerns that can cause pain and discomfort in our eyes. So one, dry eye is very common among adults, but it's very common among women that we're finding. So with dry eye, what's happening here is the eyes are not producing enough tears or they're overproducing tears. So the eye is not lubricated like it should be. So that's what causes the irritation. Sometimes people get very red eyes if they have dry eyes. Or if they blink, sometimes it almost feels like there's sand or a grittiness in the eye just because there's not that lubrication needed. With this, there are some tips and tricks that people can use. So using a humidifier at your house. With this, it puts moisture back in the air, can really help that irritation in the eyes. Fish oil supplements, they're still doing studies into this, but some people do take fish oil supplements to help, again, with that lubrication on the eye. And also, too, if it is very irritating for someone, putting a damp cloth over your eyes, a cool damp cloth, can really help that irritation and really kind of ease that uncomfortable feeling that some people might get due to dry eye. However, with dry eye, this should be diagnosed by an eye doctor, and they also will have different tips and tricks for that individual as well. Allergies too. Some people might have seasonal allergies, so they say, yes, I have a lot of pain, discomfort, annoyance. Well, okay, is it the sharp, persistent pain, or is it running eyes? Is it sometimes crusty eyes if we do have, high pollen counts in the air? So just, again, using that best judgment here is going to be the best bet. With allergies too, that should again be diagnosed from that eye doctor or that individual's primary care provider, but they do have medications, drops out there that can help clear that up as well. And lastly, again, we live in a very digital world. Kids are remote, kids are doing homework via computers, iPads, and a lot of people now are working remotely on their computers. With that is a lot of strain on the eyes. If you're looking at a screen for 8+ hours a day, there's a lot going on there. So some people might experience fatigue in the eyes or eye strain. One tip we really try to promote for this is using the 20-20-20 rule. So after 20 minutes of looking at a digital screen, you want to look up, look at an object that is 20 feet away for at least 20 seconds. This helps the eyes not only reset itself, but also it allows us to use our distance muscles and not become so dependent on our near vision muscles. With this too, we really stress for people to get outside. Sunlight is so important for our eyes, especially kids during those adolescent years, for growth and development of the eyes. So taking breaks during the day. The one thing we want to mention here though is when you go outside, even if the sun is not brightly shining, we really want to make sure you're wearing sunglasses to protect your eyes. So when you look for sunglasses, on the lens, there should be a little sticker and it says UVA, UVB protected 99 to 100%. That is just going to protect the eyes from those harmful UV ray lights from getting into the eyes. So getting outside and limiting that screen time or breaking up the screen time can really help with fatigue and eye strain over time. Going into question number 6, all about demographics and different vision risk factors for adults as they age. So with glaucoma, this is going to be the first condition we'll cover. The most at-risk population for glaucoma is going to be African American males 40 years and older. However, we do have other populations that are more at risk for glaucoma as well, and that's going to be Hispanic and Latinos and Southeast Asians. With African Americans, we are seeing glaucoma is very highly linked with genetics and family history. So we do see that being passed on from generation to generation pretty frequently in families. But also too, African Americans, they're finding, actually have thinner corneas. So when someone does go in for a dilated eye exam and they do the wonderful puff of air test, or they take the tono pen very close to the eye to measure the pressure levels in the eye, that thin cornea can almost trick that pressure system, and it can come off as a lower pressure than what it actually is. And if someone has a higher eye pressure and it's not detected and diagnosed, that's when we start to see complications come in if it is the early stages of glaucoma. Also too, here I want to mention Southeast Asians. They're more at risk for closed angle glaucoma. It all has to do with the makeup of their eyes. They are finding the iris and the lens is a lot more narrow in their eyes, so they're more at risk for that closed angle glaucoma. AMD, or age-related macular degeneration, populations most at risk for this are Caucasian women 50 years and older. They're really linking AMD with people who have very light skin tones and people who have blue and green eyes. There is some correlation between AMD and that European descent. This does not mean, though, that someone that is not of European descent can't have AMD. AMD, again, is very linked to genetics and family history. So if someone does have family history of this, we consider that person at risk. And that is the same thing with glaucoma as well. With AMD too, I want to mention they are finding as well those that don't have lack of melanin in their system are at an increased risk, as well as those that are more farsighted. Again, that does not mean someone that has more melanin in their system can't get AMD or is not at risk for AMD, but they're really just finding that prevalence become a little more common among that demographic. Diabetes-related retinopathy, or DME, or macular edema, this is going to be more prevalent in the Hispanic and Latino population as well as African Americans. We are finding that increased risk too in Southeast Asians as type 2 diabetes levels rise as well there. Again, this population is more at risk for type 2 diabetes, so that is why they are more at risk for the retinopathy. Lastly, we have cataracts. And as adults age, cataracts are very common for anybody. The eyes go through a lot in our lifetime, and for that lens of the eye to become cloudy over time, it's very common. So we see cataracts very, very common as adults age here. I also want to mention too, with the aging eye, so a piece of that question was talking about different demographics and risk factors for vision. With this, ages 40 years and older was specified in number 6. With that, the aging eye does link to other vision concerns as people go through the aging process. So a common vision concern for people as they get into their 40s and 50s is what we call presbyopia. Presbyopia is when an adult can see far away, but being able to read something up close is difficult for them. So for example, I'm going to show my mom typically does this a lot. If she's trying to read small print or a prescription label, she holds it farther away if she doesn't have her reading glasses. The thing with presbyopia is what happens is as the eye ages, so does the lens. And the lens of the eye becomes less flexible, so it's harder for that to switch from distance vision where things are clear to switching to read things up close. So that's why you see a lot of adults pulling it back. Reading glasses, though, do crisp things up and do help with this as well. So dilated eye exam recommendations, with this, we really stress people, again, to go in for that dilated eye exam. No matter what the recommendation is, we want to make sure that the dilation piece is happening here. So we typically recommend adults 18 to 55 years old. If they don't have any risk factors, if they don't have vision concerns that run in their family, we say about every 2 to 4 years to get a dilated eye exam. Adults with risk factors who are diagnosed with specific vision concerns such as glaucoma or retinopathy should go in every year or as their eye doctor recommends. Listen to your eye doctor. They know what is best for you. I want to mention here though, with diabetes, adults should be getting yearly dilated eye exams with diabetes because vision can change very quickly. Also, adults 60 years and older should be getting a dilated eye exam every single year. We saw in all of the conditions that as we age, the risk for those conditions and presbyopia increases. So we really want to make sure we're monitoring that and everything is healthy. I want to thank you guys very much for joining me again on our adult vision health journey here. Stay tuned for day 4 next week, and we will wrap things up in just a couple segments. Hope everybody stays healthy and well. Have a great day.